Good afternoon and happy St Patrick's Day to everyone. Lawfailor Padraig is a big day in our house, I can tell you. Today I want to update you about the latest public health situation and some new developments in our NHS. But as we approach the first anniversary of the pandemic in the UK, the dates when we went into lockdown, I want to start by thanking all of our NHS and social care staff who have worked so hard over the last year. Your contribution has been truly remarkable. You've helped save lives and you've helped keep people safe in some of the most difficult and challenging circumstances. We have all asked so much from our health and care services, and yet at every step of the way, you have been there to look after us. As we approach 1 year on, you're still working hard, looking after the sick and the vulnerable, and vaccinating tens of thousands of people every day to give us real hope for the future. In recognition of this enormous effort, we will be providing all NHS and social care staff with a special bonus payment. More than 220,000 people working across our NHS and social care will receive the payment in their pay packet starting next month, and we will cover the cost of the basic rate of tax and national insurance contributions. That's equivalent to £735 per person. After tax and national insurance deductions, most people, certainly those who are basic rate taxpayers, will receive £500. Students who worked in the NHS during the pandemic and some 26,000 primary care staff, including pharmacy, general practice, dental and optometry staff, will also be eligible for the payment. And I want to be clear, this is not linked to the current issue of NHS pay. We, in the Welsh Government, have submitted our evidence to the independent pay review bodies without an arbitrary cap on pay, and we await their independent advice and recommendations. The bonus payment reflects our immense gratitude to our NHS and social care staff for their extraordinary contribution to helping to keep Wales safe. Next week, I will publish the NHS Recovery Plan. Today, I'm pleased to announce a 5-year plan to transform hospital pharmacy services, including the development of 3 new regional centres to prepare specialist medicines. Wales will be the first part of the UK to develop such regional facility to prepare aseptic services. These medicines are currently prepared in hospital pharmacies. In the future, they'll be prepared in 3 regional centres, giving the NHS both more capacity and flexibility. The specialist medicines include injectable systemic anti-cancer therapy, intravenous nutrition for people who have certain healthcare conditions, which mean they can't absorb nutrients from the food they eat, and radiopharmaceuticals used in the diagnosis and treatment of cancers. We will be investing an initial £67 million to develop 3 centres, one in North Wales, one in the South West, and one in the South East. I want to turn now to the public health situation across Wales. The overall rate of coronavirus in Wales remains relatively stable at around 42 cases per 100,000 people, and the positivity rate is just under 4%. However, there is some variation in the figures associated with the number of outbreaks in some local authority areas. These have helped to push up the case rate in Merthyr Tydfil, Anglesey and Conway in particular. Yesterday, we recorded the lowest daily number of people admitted to hospital with coronavirus in the pandemic, but the figures do fluctuate throughout the week. However, there are now just under 1,000 COVID-related patients in hospital. This is the first time that we have dipped below that 1,000 mark for many months. We are making great progress vaccinating people in the first 9 priority groups, and as long as supply is sustained at the required rate, we're on track to offer vaccination to everyone in these groups by the middle of April. I do want to say a few words about the decision by a number of European countries to suspend use of the Oxford AstraZeneca vaccine because of reports about blood clots. The independent regulator here in the UK, the MHRA, is clear that there has been no confirmation that the reports of blood clots were caused by the vaccine. AstraZeneca's review of all its safety data for some 17 million vaccines administered across the UK and the European Union has shown no increased risk of blood clots. The company say there have been 15 events of deep vein thrombosis and 22 events of pulmonary embolism reported among all those given the vaccine. To put that in some context, that's 0.88 deep vein thrombosis and 1.3 pulmonary embolisms for every million vaccines administered. The MHRA's advice is very clear, and we echo and support that advice. Everyone should take up the vaccine when they are offered it. The same advice is given by the World Health Organization, the European Medicines Agency, and it is endorsed by all 4 UK Chief Medical Officers. The latest vaccination figures, which have just been published, show more than 33,500 first and second doses were recorded on our system yesterday, which is really positive news. Great work by NHS in delivery, but also shows a real appetite from the public to gain the protection from the vaccine. We closely monitor the safety of our vaccines and will continue to work with the MHRA to make sure that the vaccination programme continues to be a safe option to protect you from the significant harm of coronavirus. This week, we've taken the first steps out of lockdown. More children have gone back to school. Hairdressers and barbers are cutting hair again for the first time since mid-December. They've yet to reach me, you'll have noticed. And we've replaced the stay-at-home rule with a new stay-local instruction. We're relaxing the restrictions in a careful and phased way. We don't want to lose the impact of all of your hard work over the last few months by rushing to reopen too quickly. As we relax restrictions and we begin to mix again, the virus will begin to circulate again, and we can expect to see some more cases of coronavirus. Wherever we go, the virus will come too. That's why it's so important that we all follow the basic steps to keep us, our families and our communities safe. We need to keep our distance, to wash our hands often. We need to wear a face covering in indoor public places. We need to keep indoor places ventilated, and we need to continue to work from home wherever possible. At the moment, the rules allow us to meet outdoors. 4 people from 2 different households can meet outdoors. I know many of you will be keen to watch the rugby this weekend and to hopefully celebrate a Grand Slam. But please celebrate with members of your household only and help to keep coronavirus out. Thank you very much. I'll now take questions from journalists, and as always, all the answers will be broadcast on our live social media channels. And I think starting the questions today is James Crichton-Smith from ITV Wales. Over to you, James.
Thank you, Minister. On blood clots, do you have any Wales-specific data on the blood clot cases in Wales? And if so, what's it showing?
No, I don't have specific data on Wales to hand, but as you'll have heard, there are just over 40 cases in 17 million doses of vaccine delivered. And the unusual thing here is that actually that instance of blood clots is less than the rest of the population. So the vaccinated population are less likely to have a blood clot than people who haven't had the vaccine. It's also worth reflecting that actually one of the fairly common effects of people who have significant reaction to COVID is blood clots. People have blood clots that cause much higher rates of harm from COVID. And that's the challenge here. The balance of potential harm from a very, very low potential issue with blood clots in those 17 million vaccines delivered, just over 40 blood clots reported without definitive evidence of their link to the vaccination programme, compared to the clear and definitive harm that we know that coronavirus causes, and that's why our regulators and our chief medical officers are very clear that the vaccine should continue in use, and we encourage everyone to take up their opportunity to be vaccinated.
Thank you for that. Research from Public Health Wales has shown that visiting gyms did not increase COVID infection risk. With that in mind, has your policy around gyms been too strict, and when will you be opening them?
Well, we've indicated that we'll follow the scientific advice and the public health advice that we get at each stage. And you'll recall that we've had very clear advice in moving in a phased way. We've also had advice from our own scientific advisory group, the technical advisory group here, about the risks around gyms and other indoor areas. And gyms that operate indoors are still part of that general understanding that indoor operation has a higher risk than outdoor as well. So we'll look at each phase as we go through about which easements we can then move on towards. And it's just the reality that we can't open everything up at once. If we did that, we do exactly what our Chief Medical Officer and our Deputy Chief Medical Officer very clearly warned. A fast opening up gives every prospect of a significant rebound in coronavirus cases. I know many people will want to get back to the gym. I understand the anxiety for not just people who use gyms, but other forms of activity to want to see those areas opened up. And we will do so as quickly and as safely as possible. Ministers are still going to have to make choices with the headroom available to us, bearing in mind that our overriding priority remains getting our children and young people back to face-to-face learning. And I look forward to the 12th of April when that will happen. Thank you, James. I've now got Owen Clark from BBC Wales.
Gweinidog Iechyd. You mentioned in your opening statement about concerns about the case rates in Tydfil, Conwy, Anglesey. To what extent do you believe those outbreaks may have caused the reduction in the case rates across Wales to apparently or seemingly stall? And how concerned are you about the situation in Holyhead in particular? The local authority talking about the possibility of potentially closing schools. Would that be something you would be happy to see?
So yes, we are concerned about those three authorities in particular because they're aware they're the most visible increases in case rates. And if they'd followed the national trend overall, then we would have seen a further reduction. So they do make a difference to the overall figure. That's partly because the incidence is significantly lower. When we were having this conversation a week and then 2 weeks ago, there'd have been less impact on these figures. So in the one sense, it makes it much more visible because the rest of the Wales has been able to behave collectively together in such a way where we've managed to keep coronavirus rates low. And the challenge about Holyhead and Anglesey is about our understanding of what exactly is happening. I expect the IMT, the local groups of health, local government and other leaders gathering together with our public health officials to look at the evidence on how that spread is occurring and then to make a risk-based decision on schools opening. Because, look, what I would never say is that you can never take a step that would otherwise be the right thing to protect the public. But we also know, and this is why reopening and keeping our schools open is the major priority, is that we know that there's a real impact on our children and young people of keeping schools closed. And we know that actually our children and young people are least likely to suffer harm. So it isn't the operation of the schools that ends up being the issue that has driven coronavirus rates. It's almost always been indoor contact between adults as the biggest factor. It's still about all of us, people of your age, my age and older, Owen. It's our choices that make the biggest difference in suppressing rates of coronavirus.
Your announcement of the bonus payment to NHS and care staff is already being welcomed. Could you just give us a sense of what the total cost is of that? And I know you say that it's not linked to any future decision by a pay review body about increasing pay for those staff. But do you concede that many staff would think a longer-term recognition by a tangible pay increase to be better for them than a one-off bonus?
Well, we've arrived at the £735 figure because that means that a basic rate taxpayer should essentially take home £500. We've been able to do that in terms of what we've done at the end of the year with our resources. It means we make the decision in this year, but it'll go into pay packets over the next couple of months. So it'll be at the start of a new financial year for staff receiving it. Now, in doing that, we've had to think about the breadth of the payment as has been provided. So all NHS staff, including primary care contractors, and all social care staff as well. So there's still a small amount of work to do with trade unions and employers to make sure that everyone in scope actually receives the payment. And this, as I've made clear, and I want to reiterate this again, is not instead of a real pay rise to go forward in the pay line, not on a one-off payment. That's what our pay review bodies are doing. So this is in addition to that, in addition to the steps that I have already taken to make sure that there is a real living wage uplift for our NHS staff. If I hadn't done that, then essentially from the start of April, the lowest elements on our pay scales in NHS terms would have been below the real living wage, and the NHS would not have been a real living wage employer for a period of time. And because I don't know what the recommendations of the pay review body are going to be, it's possible that we'd have then had to make a different choice, or a new government would have had to make a different choice in the future. So I've made a choice now to ensure that the real living wage continues to be paid by our National Health Service here in Wales. And the interest in the pay review body is heightened because of the choice that England have made to try to suppress NHS pay by 1%. And I can tell you that has caused real anger, upset, and a sense of genuine betrayal from NHS staff, people that we've applauded on our streets for weeks and weeks on end, people who we say are heroes. And I can tell you, for NHS staff, it really does feel like a kick in the teeth for the UK government to say there will only be a 1% pay rise, and that's what they want pay review bodies to agree to. That isn't what we've done here in Wales. I've released the evidence and the letters that I've sent to those pay review bodies. We are not setting an arbitrary cap. The bonus is in addition to what will come from the pay review body process, and will be up to voters to decide whether they want the Welsh Government that is committed to a fair pay rise and listening to what pay review bodies have said, or whether they want to reward people who want to suppress NHS pay for their own purposes. Thank you, Owen. I've now got Branwen Jones from S4C.
Diolch a prynhawn da, Gweinidog. Isle of Anglesey Council have voiced their concerns about the growing number of cases in the Holyhead area, with speculation that this may lead to a local lockdown, as mentioned by Owen. If such a lockdown is implemented, could this disrupt the COVID vaccine rollout in the area?
Well, I don't think that retention of local lockdown measures would need to impact the vaccination programme. You'll recall that from the start of the vaccination programme, we've been in level 4 right across Wales. We've delivered record-breaking numbers of people who have gone forward, received their vaccinations safely, securely, during the period of this level 4 lockdown. So it really shouldn't have any impact on the programme. But it is an if, because there's no choice as of yet about measures around Holyhead or the rest of the island of Anglesey. We need to understand exactly what is happening and what that means. And then, as we have regularly done during the course of the pandemic, we'll work with the local health service, the local authority, and other actors in making choices together about what the right thing to do is. And I should say that I think that throughout this has been a feature of the way we've worked with local government. And you'll recall, the leader of the local authority on Anglesey is a Plaid Cymru leader there, but we have always had a very constructive and honest and grown-up relationship with her and the authority she leads in making these choices. And that will continue to be the way we behave, not just in Anglesey, but right across the country.
Diolch, Gweinidog. We have spoken to a driving instructor recently who felt that they were the last to know about the changes about last year's restrictions. Can you confirm that lessons will restart on the 12th of April, like in England?
We're going to need to run through all of our restrictions and the rules around them. So I can't give micro examples like that about driving instructors and when that would be, because we're going to need to take account of the evidence that we'll get. And of course, the 12th of April is well over 3 weeks away. So we'll have data from the unlocking that's taken place with more of our children and young people going back to schools this week. We'll then have an understanding of the increased movement for those that are able to go and get haircuts. We'll then look at what then happens when more non-essential retail is open, and we'll then have to consider what can we then do, and what we've signalled already, bearing in mind that the return of our schools to full-time face-to-face learning in a classroom is our overwhelming priority. And I recognise that individuals may say that they didn't know what was happening in terms of the conversations that are taking place, but we're talking with a range of industry and stakeholder groups. So individuals running businesses within that sector may feel that they're not part of the direct conversation, but the government really is making an extraordinary effort to engage in every sector of the economy and wider life to try to have as open a conversation as we can do, and to think about all those really difficult judgments that we still have to balance as we chart our way out of lockdown, because it is still really uncertain. But I'm sure we'll continue to talk about driving instructors as we get closer to the time. Thank you, Bramwell. I've now got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. Excuse me. Last week, you spoke about the Welsh Government drawing up new plans for easing out of lockdown, which would better reflect the impact of the new variants we're seeing in Wales. At present, many of the criteria for dropping down alert levels is simply outdated and therefore not being followed. So when is this new plan likely to be published, and how difficult is it to get these thresholds right, given the ever-changing nature of the virus?
Oh, it's a real challenge, because we know that the headline indicators and the numbers of cases reflects where we were with the former version of coronavirus that was dominant. So that's before the Kent strain became dominant. And of course, the leader of the Welsh Conservatives incorrectly claimed that we'd drawn up the current numbers on the basis the Kent variant was a dominant strain. That simply isn't true. And to be fair, your colleague Will Hayward corrected that issue last week. So we've got a new strain that is much more infectious. And last week I set out that it's up to 70% more infectious in terms of its transmission rate than the former strain. So we know that the figures need to be updated. We hope that'll be done within the next few days. The First Minister will talk to you on Friday, and I think I'll then be talking to you on Monday. And I certainly expect that by then would have been able to set out a new range obviously like the data that we'll look at, but that will always have to go alongside the judgment that we'll get and the choices Minister will have to make, bearing in mind the scientific advice and evidence we get, and the public health advice we get from Public Health Wales and the Chief Medical Officer. And if you think about a range of the factors we got, what is rarely talked about is the reality of NHS pressures. So people often talk about headline case rates, but actually we know we've got a much more transmissible version of the virus, and we know that still today, even though we're less than 1,000 beds in our hospital sector being taken up with coronavirus, that's still 2 very large district general hospitals full with coronavirus patients. It's also the case that critical care is still operating at more than 100% of its usual capacity. So that is the challenge for us in reflecting the real pressures that our NHS is under, but I'm hopeful that the First Minister will be able to confirm the updated plan by the end of this week.
That's great. Thank you very much indeed. And secondly, while we've seen GP practice staff playing a huge part in the vaccine rollout over the past few weeks, the same can't be said for community pharmacies, which appear to have taken a back seat despite the fact they administer the annual flu vaccine each year. So would you be able to update us on when community pharmacies are likely to start administering the jab?
Well, I wouldn't say the community pharmacies have taken a back seat. Lots of staff from community pharmacies have been taking part in the vaccination programme, attending the range of centres that we've provided. And when I visited the Barry Mass Vaccination Centre, again, a really good example of the partnership that's been essential, because there are volunteers there, the military have been involved in helping set up the programme, it's the local authority helping to provide the facility, and then NHS staff delivering, and that includes people from a range of different areas. So I had a dental therapist give me my AstraZeneca vaccine on the weekend, and I think that reflects the broader team, including community pharmacy. I set out that we expect more community pharmacies to come on board. Part of our challenge, though, is that our current model is actually able to deliver all of the supply that we have. And as we move forward, though, we know we're going to get more of a mixed model again as well, because at some point, more of the people who are currently delivering the vaccines, so lots of our people in general practice, their working lives may change again in terms of how they're having to balance their general practice duties in terms of caring for their patients in normal times, as it were, with the vaccination programme. So every health board has had conversations with their local groups of community pharmacies. There are understandings of the numbers of community pharmacies that want to come on board, and I do expect that over the next month you'll see more community pharmacies coming on board, but it will always depend on the facilities they have to deliver the vaccination programme itself. But I certainly think as we move forward, you'll continue to see general practice and community pharmacy being the mainstay of our vaccination programmes for some time to come. And I'm very grateful to community pharmacy the way they've worked with us. And of course, I was able to confirm significant extra funding for community pharmacy in the written statement I issued yesterday. We've now got LBC. I understand it's Dan from LBC.
Thank you very much, Health Minister. Good afternoon to you. Scotland has now joined England in publishing a very detailed roadmap out of lockdown. Almost every sector in those nations can now properly plan for life after lockdown. Can you commit to publishing anything similar that would resemble a roadmap, considering you've still got 2 weeks before the next review?
We've already given a fair amount of detail of where we expect to be up to the 12th of April. We've also indicated what's likely to come after that. So we'll then indicate for another further 6-week period at least what we expect is going to happen at the end of the next review. So we are providing a forward map for the most significant elements of activity, and we'll continue to do that as the evidence base around us is updated. You'll have seen the headline case rates. They've levelled off at just over 40 now. We want to see us get on top of those in the areas that I've already identified to see what happens in the rest of the country, and crucially to understand the impact of the easements we've already announced and the headroom we need to maintain to make sure that our schools can go back to face-to-face learning in full from the 12th of April. So we do have a forward plan, and we'll update that as we continue to move forward, and that'll be a difficult balance for ministers, bearing in mind we're going to be in a pre-election period in the very near future. We'll continue to do the right thing for Wales in making the right choices, and we'll continue to take proper account of the scientific advice and the public health advice provided by the Chief Medical Officer, which, as you know, we publish to make clear and transparent how and why we're making choices.
Thank you, Minister. And also, I understand there's been questions about Anglesey already, the case rates on the island. But tell me, we haven't heard exactly why these case rates have spiked so much in recent days. What is your understanding of the situation?
Our understanding is this is largely about household mixing again. But it's we've got the IMT, that's the local group of stakeholders drawing together local authorities, the health service and other partners to look at the evidence that's there, and will then be working alongside the local authority and the local health service to understand if there is a need for further measures. And sometimes those measures are about reiterating to the public about why we need to do things differently and about why we need to keep on following the basic ways to behave to keep ourselves safe. So that's about not mixing between households. It's about good hand hygiene. It's about wearing face coverings when we're in indoor public places, having good ventilation in particular. Doing those things and cooperating with the contact tracing service when they contact you is really important. And those are really important things we can all do to keep each other safe. Because being clear and upfront with the contact tracing is about who you've seen and where allows that service to contact them to help them to protect themselves and people around them. Because self-isolating properly for the time period that you're asked to is one of the biggest contributions you can make if you have had coronavirus, if you come into someone who's got coronavirus as well. So that's for all of us to do in all of our circumstances. And as you'll know, that's happened here within the Welsh Government, where people have isolated for a period of time, and everyone has done that because it's the right thing to do, and there can't be one rule for us and then a different expectation for the public. So thanks to everyone who is doing the right thing. We'll ask everyone to reconsider what we can all do together to help keep Wales safe and to see us out of the lockdown we're currently living with for the future in a way that is sustained. Thank you, Dan. I've now got Nicholas Thomas from The National.
Thank you, Minister. Recently, the ONS found that around 1 in 10 people in Wales had some kind of hesitancy about getting vaccinated. This was before some countries in Europe paused their use of the AstraZeneca jab. You've already said today that this jab is safe, but are you concerned that those doubts in other countries have harmed confidence in the vaccine in Wales?
It's an obvious concern that if other European countries are pausing use of a vaccine that we are commonly using, and there are millions of doses that have been delivered across the UK. I think it's around about 12 million doses in the UK, 5 million in the rest of Europe. You understand why some people will be hesitant. That's why it's so important to remind people that the evidence doesn't show that there is a material risk of blood clots as a result of having the vaccine. We know that not having the vaccine leaves people vulnerable to the very real harm that coronavirus causes, including a much higher risk of having a damaging blood clot, the much higher risk of needing hospital treatment, of suffering long-term internal organ damage, the greater risk of actually losing your life. Now, that's the sort of protection the vaccine helps to minimise and to reduce. So it's really important people listen to the evidence. It's not just me saying it. It's all of our chief medical officers across the UK. It's the World Health Organization. It's the European Medicines Agency. And indeed, it's our own independent regulator as well. So I'm expecting, actually, that the European Medicines Agency will have a further statement to make. They've already indicated their firm belief in the safety of the vaccines. And I hope that when they have a further statement to make, that European countries that have paused the AZ vaccine, in their own words, out of an abundance of caution, will then make a different choice, because that isn't just an issue for their population, it matters to us, given that Wales and Britain is a significantly interconnected country with our European neighbours.
Thank you, Minister. How close are we in Wales to being able to resume routine dental treatments?
Well, we'll continue to look at the evidence before us about a safe way to resume all forms of activity, including dentistry. So there's a professional advice the Chief Dental Officer provides. There's the advice we get on forms of personal protective equipment. And actually on my last visit to have an appointment, I thought that the setup was very good and people understood what they were doing, the reality that there are reduced procedures, but also that's because there are increased risks at some point. Now, we're having to balance our ability to suppress coronavirus with then allowing other areas of activity to continue. So this is difficult for all of us, including those of us who may want to go to a dental appointment, and indeed those people that provide dental services as well. But as I can tell you from the vaccine that I had myself, the dental profession are still busy in their day jobs, and also many people within the dentistry family are helping us with our fast-moving vaccination programme, and I'm very grateful to them. I've now got Gwyn Loader from Newyddion.
Gweinidog. On December the 4th last year, you announced that regular lateral flow testing would be available to NHS staff. Over 3 months later, staff at the front line in NHS are reporting they're not receiving regular tests, some saying they've not been tested at all. Can you explain why that is?
Well, they should be available because in the information that I've had, they're going out on a regular basis across the service. What would be more helpful is if you've got instances where that's not happening, I'd be very grateful to receive them here within the team to make sure they're being followed up. Followed up here by the central team within the government, followed up by whichever part of the NHS or social care is their employer, but also a direct engagement with local partners and trade unions to understand what is happening and the information that people are being given. This is part of both giving our staff and the public they serve the reassurance we're doing everything to keep people safe, but it also allows us to try to understand more about the current circulation of the virus as well as we're moving out of lockdown. So if you are able to share that information with my team, I'd be very grateful.
Last month at Ysbyty Gwynedd, I understand that staff were told it was down to a digital solution problem emanating from the Welsh Government. I know that in other health board areas too, doctors are saying they haven't received any tests at all. How concerning is this?
Well, I'm concerned, which is why I'd like to have the detail, because what you just provided doesn't allow me to give a proper answer and actually to be able to resolve the issue, and that's what I'm most interested in. Every time you hear of a concern or a problem, I think the wrong thing to do is to try to say that isn't true, that doesn't exist. What I want to know is the detail of what's happened, when that's happened, whether it's continuing, and what we can then do to resolve the issue. Because that's the whole point of providing these lateral flow tests. They're part of what we can do to give people that extra reassurance, to make sure we have an extra tool in our armoury to try to make sure that we understand where coronavirus is and to help people protect themselves and people around them. So as I said, I'd be very grateful to have the more specific details. If you can put them to my team, I'll happily take those up, because if there is an issue, then I want to see it resolved. Thank you, Gwyn. I've now got Rob Taylor from Wrexham.com.
Good afternoon. The number of care home staff who've had the first dose vaccine is 79% in North Wales. That figure is a small, slow increase on recent stats, which could suggest that that group is reaching the maximum level of people who will have the vaccine. Why do you think there's a reluctance in the care sector specifically to take the vaccine? Does it concern you considering the work they undertake? And if so, what's the solution?
Well, I think it'd be wrong to say that there is a reluctance in one sector to have the vaccine. We talked earlier in some of the earlier questions about whether some of the unfortunate commentary around the AstraZeneca vaccine that flies in the face of actual evidence is leading to some hesitancy. But it's also about us working through and having the first and second dose of people in that sector. A number of those people in those sector would have had the Pfizer jab, others would have had the AstraZeneca one. And again, we're listening to people all the time about if there is a real issue. Now, I've not been made aware that there is a particular problem within this one sector. And if you think about what we're doing across the rest of our programme, we're still making real progress. I think back to a week ago, and the figures on the 10th of March, they showed that in the over 60 age group, we'd only done 37.9%. In today's figures, it shows on 62.4%. So across the wider public, including people who are working age, we're seeing lots of people still keen to come forward. But again, it's always important to check and to make sure we understand what the public are saying, and if there are concerns, that we're able to address them.
Thank you. And you've previously given updates on the supply of vaccine and how that will look like. Can you give an update on what that will look like over the coming weeks? And today, data on supply has been released for the first time, showing 1.8 million doses allocated to Wales and 1.5 million are delivered. Is it possible to detail that 300,000 difference between delivery and allocation and what that means in practice? And as this is the last question of the day, perhaps I can tag on and ask for your reaction to comments from the President of the EU Commission, who has suggested looking at curbing exports to countries that have higher vaccination rates than us, and would that affect Welsh supply?
Okay, so on the challenges of the continuing rollout of our vaccination programme, I think we're in really good shape, and the figures on supply show those that we have already received and the ones we expect to have in our hands in the near future, but are essentially on their way. And that's to be as transparent as possible. We do understand there's a potential gap in some of the supplies coming forward. We may get less than we expected, but we're still working that through, and I'm going to be talking about that with health ministers in the Four Nations meeting this week, and I'll also be talking about that with the UK Minister for vaccine supply as well, to be clear about what that means, whether that does mean that it's going to have an impact on the mid-April milestone. And I think as we move out, we're not just talking about vaccines, we're talking about a whole range of things we're going to need to do to keep us safe. So the vaccination programme is obviously a key part of that, and we're showing really good progress on that here on both the first and second doses. But also, we talked a bit earlier about contact tracing, and the fact we have a very successful service. There are more figures coming out tomorrow, which will again underscore how successful that service is. And here in Wales, a service that is generally efficient. In Wales, up to the end of October, we'd spent just over £8 million on contact tracing. In England, by the same point, the National Audit Office reported £478 million. So for a much less significant spend, we've got a much better service. And actually, as we go through easing out of lockdown, that'll be really important to keep all of us safe. And as for comments made by the President of the European Commission, I haven't seen them, and I know that it's always tempting to respond to comments that you've partly heard. But I think the most important thing for all of us is to carry on doing the right thing in how we live our day-to-day lives, in keeping coronavirus rates low, in maintaining the speed and the pace of the vaccination programme, and in making sure that in our conversations with other parts of the UK and partners outside the UK, that we continue to have an outward-looking approach that tries to deal with the evidence before us and the rules that we've all had a part in putting together for our relationships with other parts of the world. But I look forward to a continued and constructive relationship with the rest of Europe, and not just with my in-laws in the island of Ireland. As my wife said, Irish by birth, caught by the grace of God. And I'd like to again wish everyone a very happy St. Patrick's Day. Take care.